live from the Wood TV Art Prize Studio at the Grand Rapids Art Museum.
Well, we are surrounded by all kinds of visually interesting pieces of art everywhere you turn in downtown Grand Rapids right now. There is another art form that you may not see until you or someone you love really needs it.
It's the art of caring for someone with a brain tumor. It's the specialty for the neuro-oncology team at Spectrum Health.
And we have Wendy Sherman with us. She is a doctor certified in neurology and neuro-oncology. And this is something women our age really need to be aware of, women and men. You know, we have the baby boomer age, and we're doing some really unique things in this community, in this field right now. Why don't you tell us about it?
We are. It's unfortunately brain tumors and brain cancer is becoming ever more frequent in our population as the baby boomers are getting older. So neuro-oncology focuses on brain tumors, but also on other cancers that can spread to the brain. So it's unfortunately it's a field that can be very upsetting for the patients who deal with it. But there's a ton of research that we're doing, and that's really, you know, a big draw that I had to come here is really to try to develop what we can offer these patients and try to really try to provide comprehensive care as you go through this very difficult process.
Yeah. Is it a bigger challenge treating someone with a tumor or a cancer in their brain than maybe a different part of their body? Is it, you know, you think of the brain, that's the central part of really our whole being.
Absolutely. I mean, that's why it's very delicate, because a brain tumor can affect who you are, how you feel, how you interact with your family, with your loved ones. And so what we try to balance is treating the cancer while also treating the person and treating your family. And it's very difficult, because it's really affecting the core of who you are and how you've defined yourself your whole life.
Right.
Really.
It's very interesting, and you are relatively new to the area. We know that you are the only neuro-oncologist in this area, and so we're so happy to have you here and treating patients and bringing this specialty right here to West Michigan. It's pretty interesting. Was reading up a little bit and I was so surprised that brain tumors can appear in so many different areas of the brain. And what is the difference, you know, between the different areas where this could happen?
So really the main difference is how it affects you. So, you know, the same type of brain tumor can affect people in very different ways, depending if it shows up in the part of the brain that controls your strength on one side of your body, or a part of your brain that controls your personality or your balance. So the symptoms that you have from it and how you affect it is really based on where it's located.
And so then when you talk about maybe different treatment options and you think about even surgeries, that has got to be really challenging, because even the process of going in to try to get rid of that tumor, that surgery itself is impacting other parts of the brain.
It is, and we have an excellent neurosurgeon, Dr. Todd Vitaz at Spectrum, and he does neuro-oncology brain surgery. And he's using intraoperative MRI, so he's using the MRI machine in the operating room to really help guide him when he does these surgeries, which is a great advance that he's able to take.
State of the art, really.
State of the art,
the highest
absolutely.
technology available.
Absolutely, which is what you want when you're dealing with your brain.
Absolutely.
Yeah.
So Wendy, why did you want to get involved in this subspecialty of neuro-oncology?
Yeah, it's a great question. Everyone asks me that. They said, you know, it's not the most uplifting field. Why are you doing this? And part of it is the science of it, because there are so many questions still out there and we don't have the answers. So for me, that's very motivating to try to get these answers for people. The other side of it is really providing compassionate care for patients. So, you know, a lot of these patients, you're talking about end-of-life issues and what are your goals in your care and what do you want out of life and what do you want out of your treatment. And I think too often some physicians sort of overlook that and just treat the disease and not the person. And so my goal is really to treat the person as a whole. And that's the whole idea behind our Brain and Spine Tumor Center and this multidisciplinary team, is you have a team of physicians who are looking at you as a person in the context of your life and what you want to get out of your life and try to make the most of that.
Because I'm guessing for some people it is a very sudden diagnosis. You may go to bed one night and feel perfectly fine, and you've had every day has been normal up to that point. You wake up with a headache, you get dizzy, you have a seizure, and then this is the diagnosis, and your world as you knew it is transformed.
Forever different.
Forever.
Absolutely. We started to talk about a new normal because we try to help people get back into a routine so they still feel like they're doing the things they love in life, but you have a new normal now, and try to help people adapt to that. So
it's such an interesting subject, you know, everything from how do you get these to how do you treat them. We have your information on the screen right now, and if you or someone you love, someone you know, maybe wanting some answers, get in touch with Spectrum Health and Wendy. And thank you so much, and we are so happy to have you here in our community, able to help people that are going through something like this.
What a blessing.
Thank you guys. Thank you.
Thank you.
We'll be right back.